All right, so I'm gonna look through, what I'll do is I'll read through the report with you, and then we can look at the images together.
Perfect.
So, all right, so large 15 centimeter mass. It's centered around the top superior part of the left kidney, and on both kidneys you have two kidneys on each side. There's an adrenal gland that sits on top of each one of those. The mass kind of engulfs both the top kidney and the adrenal gland. It also wraps around or encases the left artery and vein to the kidney. It's abutting, which means pushing right next to the aorta, which is kind of the main blood vessel that runs from through your chest and abdomen. It involves the top part of the psoas muscle. So the psoas muscle is the muscle that kind of runs from your thigh all the way up to your kind of back of your pelvis, and it basically pulls your leg up. So I don't know if you're having any pain or discomfort when you do that on the left side, but the tumor sits right on top of that muscle.
On occasion back here, in my hip area, this area, on occasion I have some pain back there. It's rare, but it does happen.
Okay.
And then when it inflamed, I took the Tylenol to reduce the pain.
Okay. And then it's inseparable, so attached to appears the spleen, the tail of the pancreas, the posterior or back part of the stomach. There was, on the CT scan, there was a separate mass in the colon, the superior part of the, what we call the sigmoid colon. The CT of the chest showed a 5 millimeter, so very small nodule in the right upper lung. So that was the CT scan. You had a left kidney biopsy. You know, that big 15 centimeter mass. You had that biopsy at the hospital.
Doctor, I have just something I want to add. That's not a question for you.
Yes.
The nurse brought it up too. You ordered a PET scan. That happened on Thursday. Did you get the results back on that? Okay,
we'll
good.
that as well.
Thank you.
So the biopsy was done on August 12th, and that showed small cell neuroendocrine carcinoma. I'll explain to you a little bit what that means, but it's a type of cancer. I would say that it's not the most common type of kidney cancer we see, but it is a small cell is a type of cancer that we see both in the lung. We can't see it in the kidneys, the bladder.
Oh, I'm so
etc.
sorry.
Okay. It was described as high grade. What the grade is when the pathologist looks at the tumor under a microscope, gives an estimate of how aggressive it looks. It can be high, intermediate, or low grade. The higher the grade, the more aggressive looking it is. It's based on the features of the cells. Okay.
And my read on that was high. How was that rated?
It's a low, intermediate, or high grade.
But how was that rated? Or are you about ready to tell me on that?
Yours was high grade.
High grade.
Yes,
okay.
I'm sorry. And then you underwent a colonoscopy. And so the colonoscopy was done on August 22nd.
Correct.
Basically, the colonoscopy showed that there was a mass near the sigmoid colon. It appeared to be pushing from outside inwards rather than the mass inward going out. It was 40. The way we assess where a mass is from a colonoscopy is we take from the anal urge, from the anus, measuring in centimeters, estimating from there. So it looked like to be about 45 centimeters from the anus. Take a look here. And then, so that was just the 22nd. And then you had your PET scan done recently on the 26th, 4 days ago. So that showed a large mass in the back of the abdomen we already described previously. There is a number that is associated with how bright it is on the scan, and we're going to look at the scan. But the mass, that number, so as far as a quantitative measurement of how bright it is, or the SUV, is 9.2. It will make more sense when we're looking at the images. There were multiple other masses in the abdomen and pelvis, and they range from 5 centimeters in the right upper abdomen near the liver with a SUV or brightness of 7.5. So remember, the large mass was 9. This one on the right side was 7. There was also another mass on the right retroperineum in the back near the right kidney, about 2.7 centimeters, SUV of 4, so that's a little bit less. On the right pelvis, 2.9 centimeters, SUV of 8, 8.3, okay? And then inferior left pelvis, there's the sigmoid colon. This is probably the one that they saw on the colonoscopy, 4.6 centimeters, so about 2 inches with the SUV of 7.9. So the brightness is like 7.9. So it looks like there are multiple tumors in the abdominal cavity. They did see on the PET scan that very small nodule in the right upper lung, but it was so small that it doesn't pick up on the PET scan. And you said that occasionally you have some pain on the left hip. Do you have any pain in the abdomen still? Or
all the time,
okay.
all the time. For the last month and a half, basically it's right here all the way down to my pubic bone,
Okay.
and it's very common to have audible gurgling of things going on. It's trying to settle itself.
So 0 to 10, what would you say that level of pain is? 10 being the worst pain in your life, 0 being no pain.
Right. No, I would say it's about a 6.5,
Okay.
sometimes 7.
Okay. And okay. And then do you take anything for it?
Alka-Seltzer, Gas X, when I can't pass gas. But usually when I go to bed, doctor, in order to settle my stomach, to kind of quiet it down, I have to take an Alka-Seltzer to quiet it.
Okay. And do you take any Tylenol, Advil, hydrocodone, tramadol, any
No.
opioid? No. Okay, so
No,
no pain medication specifically.
Not at all. And if you could write that in the orders, if it's recommended, it would be nice. Otherwise, I treat it myself with the Gas X and the Alka-Seltzer.
Excuse me.
Yeah.
Don't you take some Tylenol from time to time?
No, just rarely, only once or twice for my hip, the pain back here, when that one area would hurt, and that would maybe once.
So does the Alka-Seltzer and the Gas X, does it help with the pain? You sound like you have pain all the time. Do you want to try something for pain, or have you ever taken Tylenol or Advil to see if that helps with that pain, or?
No, because typically I just, from a gastronomic standpoint, if I can even use that word, it's just my system, with what liquid and it has in there, it settles it, so it quiets my stomach so I can go to sleep. Otherwise, I'm awake. And then I supplement that the Alka-Seltzer with Gas X and a walk around the block. I'm trying to free up through aerobic activity my gastronomic system, kind of pass some gas if I can. Right now, I'm not experiencing any stool. I had my last stool was 4 days ago, because I'm on liquids.
I'm sorry, you said you're on liquids?
Liquid, yeah.
Yeah, he cannot take
that
any solid
No
food.
solid food.
Otherwise, he has stomach ache. So
Beef,
what I've been
chicken broth.
what I've been doing is that giving him some chicken broth, and I strain that chicken broth to give it to him. Otherwise, if there's a little solid food in him, it's really bothers him a lot.
So it's painful to eat solid
Oh,
food?
forget it. Just forget it. I don't even think about solid food. I mean, I can have like half a churro or something, and it'll stay in my system. It won't pass through.
It won't digest.
It
That's
won't
what he's
digest.
saying.
I mean, I won't vomit it up, but it won't easily assimilate into my system. It feels like it's got to go through like it's crowded down there. That's sensational.
When was the last time you had solid foods?
I don't remember, at least 2 weeks ago,
Okay.
about 2 weeks ago.
About, yeah.
Doctor,
May I
if you-
say something,
yeah,
Deb?
I'm just gonna say, doctor, with your permission, can I just have Sarah, cause she has a patient coming up, in about 7 minutes. Can she just ask a few questions and then she needs to hang up, is that all right?
Sure. Mhm.
Go ahead, Sarah.
I'm just gonna listen as long as I can. I just wanna say thank you. My area of expertise is pain. I'm a physician assistant out here in Wisconsin.
Mhm.
So I appreciate your care and explanation for my father. From what I'm understanding, what I've been talking with him, and he has a pretty high pain tolerance, but he is not sleeping very well. And I think that that's partly why he can't seem to catch up. So just from my understanding, even though he's got the slow bowels, even just to have, going back to your question about the pain, just to have something like tramadol, which is
Mhm.
a little less constipating than codeine or something, just to
Mhm.
help him if he needs it.
Mhm.
As needed might be something to think about. It's not terribly strong, but it could help
Sure.
better
That's
than
what
Tylenol, because I think he's trying to avoid some non-steroidals a little
Mhm.
bit, that irritates the stomach as well.
That's what I was thinking,
And
maybe
it's-
trying some tramadol.
Okay. And then as far as the diet, what we're trying to do and what I'm trying to do from over here is set something up where he's still getting good nutrition because he is losing weight, and I know part of that is just due to the tumor itself, but
Mhm.
we're trying to get him on a regimen of nutritional shakes. Just feel like he's drinking all the time of
Mhm.
homemade chicken broth and vegetable juices and fresh pressed fruit juices, and then some extra nutrition as far as vitamins and supplements, just kind of as a baseline so that we can keep him feeling stable.
Absolutely. Yes, that's, I would recommend continuing that, and then, as we start the treatment and talk about the treatment, it would be interesting to see if your digestive problems improve. So if suddenly you're able to eat, and you're able to eat in larger portions over the next, several weeks to a month, then that would be a good sign that we're definitely on the right track. Okay.
Sarah, do you have a patient coming up, Sarah? Do you have any key questions you'd like to ask the doctor? Right now, and the doctor may or may not already know this, but I gave you permission to discuss with the doctor at his available time. But do you have any immediate questions you'd like to ask him before you take your next patient?
Well, just to let Dr. Wynn know, I did write down some questions to you in case I can't get through them, but I was just curious, you did kind of go through some of the other locations of the masses in his abdomen and pelvis, which was new to us because we couldn't review the PET scan results. I did also want to know, is it pretty confirming that mass in the sigmoid colon is related to the neuroendocrine type of tumor?
Yes, I mean, my suspicion is that this is all one disease, and that
Okay.
given the size of the mass and the type, the histology is small cell, it's not surprising. These are very aggressive cancers. So.
Okay. And would you say that they are something that has been slow growing, or is this a fast developing type of tumor?
Usually when we think of small cell, we think of rapidly growing tumors.
Okay. Okay. And from what you're seeing so far, and I don't know how much you've had a chance to review his history, is this a neuroendocrine where it's more of like a functional influence by the hormones? Are they releasing active hormones, or
No,
not primarily just because of its location?
Yeah, not typically, not small cell. We don't usually think of them as functional neuroendocrine.
Okay. Okay. And then I'll let you continue to explain whatever you have to work through, which is fine. I just was curious, once you get to the treatment plan, my preference is always whatever we can do that will least affect knocking down his immune system, because it's not my area of expertise. I don't know. I'm definitely not up to date with chemo treatment, so I look forward to hearing what you recommend.
Sure, absolutely. All right. So of the everything that's happened so far, we've gotten basically through the PET scan, right? So And then at this point, what I was gonna do is I was gonna show you some of the images of the scans you had. But before then, what I wanted to do is just go over with you the anatomy in the abdominal cavity. So then once I show you the scan, it'll make a little bit more sense, okay?
Perfect. Do you want to, sir, you want to hang in there or you want to hang up? Do you have your first patient coming in right now?
I'll tell you when I'm leaving, don't worry.
Okay, we'll leave you on there, okay? So we're looking at some images right now.
So, just in general, when you eat, your digestive tract goes through your esophagus into your stomach. Stomach is like a sac like this. And then after the stomach is the small intestine. So you pass the stomach, there's a little valve here, it goes into the small intestine, and it just, it's just a large tube. And this is where a lot of the digestion happens. The small bowel is kind of floating in this connective tissue, so it moves.
Sure.
And then after it passes the small intestine, it goes into the large intestine or the colon. So the colon goes ascending, transverse, descending, and it's fixed. So this part is fixed, meaning that it doesn't move. It just the food just travels through there. This part moves around. So when you have sometimes you can have bowel obstructions. It's a small bowel that's being obstructed because it's not able. It gets kinked, for example. So imagine like a balloon that suddenly gets kinked. A large intestine, so the colon here through here. This is the sigmoid colon, a rectum, and out. Okay, and then the other thing I wanted to cover was the anatomy of. Let's see this. All right. Let me see here. Let me show you here. All right, so let's take a look at this image here. So you remember this image here. So the digestive tract, the stomach. Okay, this is the liver on the right side. So the liver is here. Your stomach normally sits right there in the middle. So we're gonna see. I'm gonna show you a picture of where the pancreas is. We're gonna remove the front is the stomach. We're gonna cut that out, and so you're gonna see what's behind the stomach, which is this. So remember the stomach was right here. Now we're seeing a picture where the stomach's removed, and this is the small intestine. Remember I was showing you that, and then the small intestine. So why is that? Why do you do that? Because behind there, you will see the pancreas. The pancreas fits into the stomach is in front. The pancreas is right behind it. The pancreas sits right snug into wraps around the small first part of the small intestine, wraps around the head of the pancreas. So the anatomy here is kind of complicated, and it's in 3 dimensions. That's why we're going over this in detail. So when I show you the scan, it'll make a little bit more sense. Okay? So there's the pancreas. Behind the pancreas are your two kidneys. Okay? The kidneys have 2 adrenal glands right on top of them. Okay? The end of the pancreas sits the spleen. Okay, the spleen is about the size of your fist, like this. So this is what this looks like there. Okay, without the stomach, same thing. Okay, does that kind of make sense?
Yeah.
Okay. So let's start looking at the images of the scan. We'll start with the CT scan. Okay. All right, I pulled this up already. So this picture here. You're standing, looking right at us. Okay. This